The first report of a COVID-19 case in the U.S. came on January 20 in a man who returned on January 15 from visiting family in Wuhan, China, to his home in Snohomish County, Washington. He sought medical attention on January 19, 112. The second report of a COVID-19 case U.S. came on January 24 in a woman who returned to Chicago, Illinois, on January 13 from visiting Wuhan. 3-4 The woman passed the virus to her husband, and he was confirmed to have the virus on January 30 in the first reported case of local transmission in the United States. 7. On January 30, the WHO declared the outbreak a public health emergency of international concern, warning that all countries should be prepared for containment. 123 The next day, January 31, the U.S. also declared a public health emergency. 124 Although by that date there were only 7 known cases in the U.S., the HHS and CDC reported there was a likelihood of further cases appearing in the country. 124 In response to the global outbreak, the American federal government implemented a series of travel restrictions denying entry to foreign nationals who had traveled within the past 14 days in certain affected countries, with exceptions for the immediate family of American citizens or permanent residents. The countries were China, restrictions effective February 2, Iran, effective March 2, the 26 European countries that comprise the Schengen area, effective March 13, the United Kingdom and Ireland, effective March 16. 1537-38 Americans returning home after traveling in these regions were required to undergo a health screening and submit to a 14-day quarantine. 125-126 In early March, the CDC advised Americans against non-essential travel to China, Iran, Malaysia, and the aforementioned European countries. 127 The WHO declared the outbreak to be a pandemic on March 11, 40. Throughout March and early April, several state, city, and county governments imposed stay-at-home quarantines on their populations to stem the spread of the virus. 128 By the middle of March, all 50 states were able to perform tests, with a doctor's approval, either from the CDC or from commercial labs in a state, but the number of available test kits remained limited, which meant the true number of people infected had to be estimated. 129 The CDC suggested doctors use their own judgment along with certain guidelines before authorizing a test. By March 12, diagnosed cases of COVID-19 in the U.S. exceeded 1,000. 130 Administration officials warned on March 19 that the number of cases would begin to rise sharply as the country's testing capacity substantially increased to 50,000 to 70,000 tests per day. 132 By March 27, the country reported over 100,000 cases. 133 On April 11, the U.S. death toll became the highest in the world when the number of cases reached 20,000, surpassing that of Italy. 134 On April 28, the total number of confirmed cases across the country surpassed 1 million, and by April 29, according to Johns Hopkins University, at a minimum, 58,356 people had died as a result of COVID-19, more than the Americans who had died during the Vietnam War. 135, 136, 137